We have an amazing case today. This is a huge mommy makeover. I'm doing Lipo 400, which includes the entirety of the front, the entirety of the back, with the BBL, with rib remodeling to bring in her boxy waist and square frame, doing a breast augmentation above the muscle, 500cc implants, and a tummy tuck. This is one of the penultimate mommy makeovers. It's going to be a masterpiece of a transformation, so stay tuned.
So I've been thinking about it for a very long time. I actually got pregnant at 19 and had my twins at 20. So you want to say about 16 years I've been thinking about this. Now is the time because I know I'm not going to have any more children. I'm done having kids, 4 kids later, and I feel like my body has done amazing things. Now it's time to be a little selfish and give myself the time and the body that I deserve and that I've been waiting for. It's that time, you know, for me to have that confidence to walk around and feel like the woman that I really want to be. The reason I chose it is because I've always had this boxy figure. I've never really had like a curvy figure. I've always been very athletic. And when I saw Dr. Marshall on Instagram that he does the remodeling, I saw his work and immediately knew that that's what I wanted. I've always wanted, you know, a smaller waist. I wanted to enhance my figure, so I knew that he was the guy. So Dr. Marshall and his staff, they've been great. A text message, if any concerns, they'll answer back anytime. You know, the ladies in the office have been great. They have been very supportive. They make you feel very comfortable. And Dr. Marshall, he's just a genius. And I feel like I'm in great hands with him. So in a couple months after my surgery, I'm definitely looking forward to just wearing clothes that make me feel very, you know, in a way sexy and comfortable and confident. That's my main thing, just putting on an outfit and being okay with it. Not having to try on 10 different outfits just to go out to dinner with my husband on a date night to look perfect. I just know that whatever I'm gonna put on is gonna look great.
With all tummy tucks, I do Lipo 400. I know a lot of people get tummy tucks and they'll just get lipo of the hips and the flanks, but my philosophy is I need to shape and recontour the entire torso. So that includes the upper back, the middle back, the lower back, the pre-sacral triangle. To me, that helps to enhance the entirety of the tummy tuck, especially when I'm able to get the full lipo of the back, the sides, and the front. So no half lipo with my tummy tuck. Alright, so my tumescent's in, my baser's in, so now I'm going to do a stepwise liposuction of the back. So I'm going to start with the upper back here, and then I'm going to go to the mid-back section here, and then I'm going to hit lower back, area number 3, and then the last area will be area number 4. So I'll do that on both sides, and then once that's complete, I'll do the fat transfer. Alright, so I've done lipo of the entire back, the flanks here, in this pre-sacral area, and so this is how much fat we have out. So we have just over 2,000 cc's of just the yellow fat. So the fat is the yellow part above, and then this part is just the fluid that I put in, and that's some of the tumescent, and whatever minimal blood loss we have, it kind of makes that fluid go from clear to this reddish color. But it's not a whole lot. It looks like a lot, but it's not. But that's standard liposuction. And now we'll take this fat and we're going to put it in the butt. All right, so I'm using ultrasound guidance for the BBL in this patient today. So I have my wireless probe here, and so right now I'm over the center of the buttocks. And so what we're seeing here, this is the buttocks muscle. This little white line is the fascia, or the strength or protective layer around the muscle. And then above that is the fat. And then this gray line right here at the top, that's the actual skin. So when I'm doing a BBL, we want to avoid putting fat in the muscle where it's dangerous, and we put the fat here with the other fat in the deep layer. So by using the ultrasound, it helps us to know exactly where we're at. We can keep the fat in the fat of the buttocks and give good projection. So here in the middle of the screen is my cannula, this little circle right here. So the muscle is down below. I'm not in the muscle. I'm My cannula is right here in the center of the screen, and then you can see the fat going in. That's those gray lobules, and that fat is going in above the muscle. So when I'm doing my Riblux procedure, I use this nice fancy device called the piezotome. It's got a little sharp point here. This is a custom design, but it helps to cut bone, but it doesn't really cut me, but it does irrigate the skin with some fluid, and that puts a small little cut in the bone. And then I'm able to go back and apply some pressure and complete a monocortical fracture. So, 1, 2, 3. So the sounds you heard, those are just monocortical fractures there in the bone. I first scored it with my piezotome, and then I just completed the fracture. And so that's what's going to help bring that waist in as she wears the corset. So I have a little fracture here, right where that Q-tip is pointing. That's what we want to see. And so we want to, not a complete fracture, just a green stick fracture right there. And once new bone forms, that's going to give us our smaller waist. So some basic anatomy with the ultrasound. I'm looking at a rib right here. This is rib number 11. This is actually muscle on top of the rib, and this is the skin right here. This structure underneath that's sliding back and forth is the lung. And this little white strip here is what we call the pleura of the lung. So going here, that's rib number 10. And the muscle is above it, and the rib is sliding below. So you can see how close the lungs is to the rib, and so it's very important to know your anatomy and to be very safe and skilled with this procedure, or you could cause a lung injury. Fortunately for me, I've done over 1,000 rib fractures and no lung injuries, and so our goal is to keep it that way. So safety first, knowing how to use ultrasound, but also good technical skills are important for this procedure. Completed the liposuction of the back, upper back, middle back, lower back, the presacral area, done the BBL, and we've done the posterior portion of the rib remodeling, 4 ribs on the right, 3 ribs on the left. Next up, we'll flip her over, do the breast augmentation, lipo, ribs, and tummy tuck. All right, so I'm gonna be doing a breast augmentation. It's gonna go above the muscle. I'm gonna make a tiny incision in the crease here, and then elevate the breast tissue up, and then put the implant underneath there. And then once that's done, I'm gonna complete the Lipo 400, lipo on the sides here and the front. And then I will do the anterior portion of the Riblux. So we will decrease this projection that she has here and bring the waist in. And then once that's done, then we'll remove all this extra skin. With the tummy tuck, we'll tighten the muscles here to really bring her waist in to complement the ribs. Do a pubic lift as well, and call her a day. Whenever I start a breast augmentation, I always inject some long-acting numbing medicine. So this has epinephrine and some other pain medicines which help to decrease bleeding, but it also helps to keep you comfortable during the procedure and afterwards. So here's the implant inside here. This is a Motiva 500cc ergonomics. And so these implants, when you're laying flat, this is how the implant sits. It's nice and round. And then when you sit up, it has a little bit more of a teardrop shape, so it has a little bit softer feel. So there's 2 types of implants, one that has more of a natural look and feel to it, and one that has even more fullness at the top. Okay, so when we put the implant in, we use a funnel. This allows us to get a relatively large implant through a very small hole. So we twist it like this, put a little pressure, and the implant will go into the incision like that. All right, so bilateral breast augmentation done, 500 cc's, ergonomics, high profile implants, Motiva, so she's gonna have some nice good cleavage here in the midline. We have the implants centered nicely on the breast mound. Next up will be the Lipo 400 in the front, for our Lipo armpit area, the lateral chest area, and the abdomen. There's a common misconception that just because you're getting a tummy tuck, you're not able to get stomach or abdominal lipo. And I think this comes down to surgeon preference. And so there's a lot of surgeons who say it's unsafe because you'll damage the blood supply, but I found that there is a way that you can safely lipo the entire abdomen during a tummy tuck, but still preserve the blood supply. A lot of it has to do with the actual tummy tuck and how many blood vessels you're preserving, but in all tummy tucks, I do lipo the upper abdomen. Alright, so I've completed the liposuction of the abdomen, and so now we're going to address the front ribs. And so this patient's very boxy in general, and she actually has some protuberance of her ribs right here. So with the front rib procedure, I'm going to fracture this rib at the junction of the cartilage and the bone, and that's going to help decrease this protrusion, which will help to decrease her overall circumference and contribute significantly to that smaller waist as it transitions down. So right here is the fracture, right here in the middle of the screen. So you can see where I've broken that rib, and then wearing that corset, it's going to cause that front rib to be less prominent. So now the belly button is freed up from the tissue, and so I'm going to go from underneath and free up tissue all the way here, but we'll save this belly button. I always find that it's important during your tummy tuck to make sure you take the fat out from the vaginal area. There's nothing worse than seeing a very nice tummy tuck with a very puffy vaginal area, and so a lot of that is just because there's excess fat here. And believe it or not, I already did lipo here, but I'm going to remove some of the fat that did not come out with lipo so that she has a nice contoured upper vaginal area. Interestingly, today as I'm doing my dissection, you can see just how bad her diastasis is. So you can see this is her muscles here. These are her six-pack of muscles. And after 3 kids, not only does the fascia, which is the white tissue covering the muscle, get stretched out, but now there's also a separation. So when people talk about muscle repair, what we talk about is bringing these 2 muscle edges back together. But you can certainly see this gap here between the muscles from pregnancy. All right, now that my muscle repair is done, I want to make sure the patient's comfortable for a few days post-op. So I inject him long-acting pain medicine right underneath the fascia and along the incision, and that really helps to take away the bite of that initial pain. So maybe if your pain would be a 10 without this, maybe now it'll be a 4. So I love having the patients comfortable after surgery because then you're able to breathe better, walk better, move around, and decrease your risk of complications. All right, so I've taken off the extra skin from her lower abdomen. You can see this was where her old belly button was right here. And so I've removed all the skin from the lower portion of the tummy tuck. This is a standard tummy tuck, and this is how much skin typically gets removed. Most people don't believe it, but I've pulled as tight as I can, removed as much skin. And so now everything is just stapled together. We'll put some sutures in and close it up. Just finished up an incredible mommy makeover, mother of 4. We did lipo 400, rib remodeling of the back and the front ribs. Did a BBL silicone breast aug with 500cc Motiva implants for some upper pole fullness and additional cleavage, a Dre Sculpt tummy tuck with muscle repair and fat transfer to the hips. She's gonna have a nice smooth recovery. She's gonna have a new body just in time for Fly Girl fall, and her winter and next summer are gonna be even more incredible.